Good morning and welcome to our introduction to the European Health Data Protection Congress, an event organized by EFDPO and MyData-TRUST in partnership with MyData-TRUST. For those of you who do not know MyData-TRUST yet, we are a service provider in the field of data protection for the life sciences, and for example, we act as an external DPO for some of our clients. Today we have a very special guest who is Pierre Lastic, the Secretary General of the EFDPO and the Vice President of the EHDPO. So Pierre, can you tell us a little bit more about you, about these two organizations and their missions?
Hello Anastassia, and thank you for organizing this event. I am currently working after a long time, 30 years in the pharma industry, working mainly in clinical research. And the last 15 years of my career, I started to do in parallel to research also data privacy. So I became a research and development privacy officer for Sanofi back in 2005. And in 2013, in provision of the introduction of GDPR, I became the Chief Privacy Officer of Sanofi. And as I retired from Sanofi in 2019, I took a position of a Vice President with the Union des DPO, so the French Data Protection Association dedicated to the interests of data protection officers. EHDPO is member of a European federation, the EFDPO, the European Federation of Data Protection Officers, where we have now 18 national organizations from all over Europe who are joining force to help data protection officers do their job, improve their situation as best as possible, develop best practices, discuss with authorities at the national and international level. It's better to have a greater voice as a European federation, and so we are in constant contact with the member of the European Commission, of the European Data Protection Board, and also with people from the European Parliament, for example. This organization has a number of working groups, and one is the Health Data Working Group that I lead. And this working group is also the one that has been co-developing the program of this first Data Protection Congress.
Thank you very much. A very impressive history you do have in the field of data protection and GDPR in particular. And data protection officers is indeed a new profession. So certainly data protection officers existed before, but now it became really a true profession with a lot of data protection officers in different sectors. And therefore a federation or a union for this DPO, I think it's a very good initiative, which is very welcome. But a union of DPOs or a federation of DPOs could speak about so many different topics in so many different sectors. So among all the topics the DPO can touch to, why health data specifically?
Well, first of all, I think that health is probably at the top of the interests of any human being. So health is something that everybody is concerned about. Everybody will be sooner or later a patient. So health is really close to our heart. And the protection of health data is especially important because there is a big potential for discrimination with the misuse of health data, but a great potential for improving our lives with the use of health data. So we are at the crossing of two diverging interests. So the benefit and the risk of health data are huge. And of course, with my background in clinical research, I'm heavily interested in healthcare and biomedical research. This is why we have chosen this topic. But of course, you will see when we go closer into the matter that this touches also many areas like artificial intelligence or other. One also very important topic in the work of a DPO, which is dedicated to healthcare, is that GDPR is a European regulation, but healthcare is not under the mandate of the European Union. So it's ruled by national law, which leads to a lot of discrepancies and differences between countries. So the way health data is protected in different countries is very often linked to the differences in other legislation, especially if you look at the French healthcare system is pretty different from the German one, or the Belgian one, or the Scandinavian one. This means that, for example, when you conduct a clinical trial across several European countries, then you will see that people are of the opinion in Germany or in France that the legal basis for a clinical trial is not the same. Or you will have differences in the informed consent that you need to develop. So having a common informed consent would be, of course, of interest for multinational trials. So this is an area with plenty of practical questions, even if in the recent years there have been harmonization with the regulation of clinical trials and regulation of medical devices, but still differences are still important and needs to be discussed.
You are very right. Indeed, one of the initial goals of GDPR was a better harmonization of the requirements in relation to the data protection in Europe to enable a free flow of data, at least within Europe. And this harmonization was achieved to some extent in certain sectors, but indeed it's much less achieved in the health and life science sector, because health data are special categories of data, and there is a big derogation in there which enables member states to add additional and stricter rules, which indeed ends up in a very heterogeneous framework. You already touched a little bit to the topics that will be discussed during the conference. I'm very curious, can you tell us a little bit more about some of those topics?
Of course. There are a number of anchor points. The first area of focus will be the legal framework of health data protection in Europe, and to illustrate the diversity of the situation in different countries, we have the pleasure to have the CNIL, the French Data Protection Authorities, that will be presenting the guidances and reference methodologies in the field of healthcare and medical research. We have the pleasure to welcoming the Norwegian Data Protection Authorities, who have a lot of experience in registries, for example, and will explain what they do in order to help TPUs and help people in general in the protection of health data. And we have also practical example with the DPO of a large university hospital of the Czech Republic, who will tell us about the practical difficulties of DPO work in a multinational environment like clinical research when you're a hospital DPO. So this is more to the framework. Of course, you have heard of the regulation, which is a proposal for regulation for the European health data space. And so we will have a presentation of the European health data space with a number of a discussion of the issues which it brings in terms of international cooperation. For a reminder, the European health data space aim at creating an area where European citizens will be able to access their medical record and give access to a medical record in different countries. So if you are becoming sick you're from Belgium, becoming sick in Portugal, or if you are crossing the border every day between France and Germany to work on the other side of the border, also you would be able to transfer your information between the two countries. And this is important for citizens, but of course, the main area of improvement will be in an harmonization for medical research and the development of new medical devices. So EHDS is a very big topic. And EHDS is also will be benefiting from the development of artificial intelligence, and artificial intelligence is pervasive, is already in use in many areas of healthcare and research. The work of radiologists, for example, medical imaging has been considerably improved by the use of artificial intelligence, but of course we also know that there are a number of risks linked to artificial intelligence, and there will be a whole discussion about this topic to see what in practice it means to assess artificial intelligence projects. And last but not least, all of these questions rely heavily on the secondary use of health data. And we will have, of course, it will be certainly addressed at several parts of the Congress. We will have, for example, a workshop on code of conduct for the secondary use of health data that have been developed by different organizations like UCRO for BBMRI or IHD, and they will be presented. And we will have also a panel discussion with different stakeholders or users of health data, for example, to train artificial intelligence algorithms, for example, but also simply to conduct long-term studies using hospital data that has been collected over many years. So secondary use will be a very big topic.
Very interesting. But some people may even argue the artificial intelligence or even secondary use of data, do they really use still personal data? Aren't they using anonymous data?
Well, in a few cases, it is, of course, anonymous data can be used with health data. So some health data can be made available anonymously, and this is the case when you do general statistics about the use of drug or about prescription behavior, about general public health statistics can be using anonymous data. But if you go into clinical trials, you need to have traceability because otherwise you would be opening the door for fraud and for wrong results. So also, if you want to study the evolution of disease over a long period of time, you need to have the identification of the patient. So this is pseudonymization is more the rule in the clinical research area. And when it comes to developing new algorithm, then there are new technologies that have been developed, like the use of synthetic data. And we will also address this and try to answer the question, what is the right methodology for my purpose? Do I need to use fully anonymized data or pseudonymized data, or can I use synthetic data, and how do I generate them? So we will be addressing this very practical question also during the Congress.
Thank you very much. Very interesting. And addressing this question, so it's a question that might be addressed in so many different conferences, but the specificity of this one is that on some of the panels we will have people from Data Protection Authority, so that brings a very interesting angle and light to it. So thank you very much. Whom should attend? So to what type of audience would you recommend attending this conference?
Typically, this subject is multi. How do you say? It will involve multiple professions. Of course, we are a European Federation of Data Protection Officers, and our first stakeholders are data protection officers and privacy officers, privacy professionals in general. Of course, we will have data protection authorities participating. We will have representatives also of the Ministry of Health from who are dealing with the European health data space. We will have also the DPO of the European Medicines Agency, so clearly the agency that regulates the development of drug and devices. So I think that not only DPO will be interested, lawyers, IT professionals, but also doctors and people who are in charge of protecting data in hospitals, and even we will have a session about the use of health data by insurance companies. So this is also a topic that might be of interest for people who are working in these insurance companies, people working in hospital, people working in clinical research in general. So this is a very wide spectrum of professions, and we really want to promote the dialogue between these different professions. And if I may give a practical example, back in 2005, when I started to work as R&D privacy officer for Sanofi, one of the first meeting organized was a workshop with representative of the data protection authorities and of the European Medicines Agency, because these are people that normally don't talk to each other because they don't know what the other do. And unfortunately, our society is made of silos where there is very little communication between the silos. So the main interest of this Congress is to make people break the silos, talk to each other, understand how they can better work with each other and harmonize their practices.
So, interesting event with great topics, opportunity of networking, high-level speakers, including from authorities and prestigious guests. Great conference to come. So, where and when?
Well, the conference will take place in Paris. We have a very nice place in l'Orangerie d'Auteuil, which is in the western part of Paris. So people who are interested in sport will know that not too far away from this place there is Roland Garros, where we have a famous tennis tournament every year, and Le Parc des Princes, where the PSG football club is playing often. And today we are in a very nice area. This will be on 24th and 25th of October, so in about a month. And you will be able to find the registration link in LinkedIn. It will be posted with this video, and we have a website dedicated to the Congress, which is EHDPC.org. You can go there and register. And if you register before September 30th, then you will get the early bird rate, which is 30% below. And we have also reduced rates for students and for our member organizations, of course.
Well, thank you very much. So let's see all of people who attend and many more others in 1 month's time to discuss a dream topic in a dream city. And thank you very much for watching this video, and see you in 1 month.
Thank you very much, Anastassia, and see you in Paris.